Okay, hello everyone. This is another video under the Psychology 9990. All right, now this time around, I'll be looking at the issues and debates in the A level, okay? A level category. Now let's dive into it. All right, now the first thing we have is cultural differences in psychology. Okay, the behavior of people from a particular environment might not represent the behavior of others from a different environment. I think you will agree with me on that. So when it comes to evaluation of some of the studies, all right, be quick to talk about cultural bias if the people used in the study do not reflect multi-cultures, okay, different cultures. Now, number one, cultural bias, what does that talk about? Psychological research may be ethnocentric, that is focused on a single culture, meaning it is based on the norms and value of just one culture, making it less applicable to others. All right, you did something in, let's say, for example, you did something in Japan, okay, or you did something in Korea, you did something in um, Jamaica. The finding of that result, the finding of that study rather, might not be applicable to what you will obtain if you had carried out the research in a different culture. You understand? So talking about the method you use, the materials you use, and then the way the participant responded might not be the same way they will respond. Now, you did a study on maybe how to assess schizophrenia, how to measure schizophrenia in people. All right. So the behavior you used in that questionnaire to assess them might not represent the behavior you find in another country. Okay. You're using BDI to measure depression, which is Beck's depression inventory. All right, the behavior you wrote there might not be the same behavior you find in other culture. All right, maybe you expect people to be very happy, to be outgoing, okay, to be very, very fun in terms of their behavior, all right, and how they handle things, okay. But then if you discover that people are not always fun as you expected, all right, then the next thing you want to think about is that probably there's a symptom of depression, right? Okay, but then you can have other culture where people are naturally calm. People don't talk to people as such. They are just calm, the live for themselves, and then they just kind of live in isolation. All right. You can have streets like that that are very quiet, whereas you have other streets, even within a particular country, where people are naturally noisy. Okay, if nothing bad like war happened in that city, or let me say state, for example, you see all of them out there making noise, whereas you have other city where people believe that, okay, you should stay indoors, don't talk to people as such, you only say hello and that's it. Okay, so measuring such behavior depression within this different culture, it has to reflect the measurement, or let me say the diagnostic tool needs to really reflect that culture. So if it doesn't, we say there is a cultural bias. Okay, now type of culture, we have individualistic culture. Okay, for example, USA, UK value independence, personal achievement, and self-expression, right? Okay. However, we have collectivist culture. Sorry. All right. Okay, where you have the situation of China, Japan, who emphasize group harmony, cooperation, and shared responsibility. All right, so this kind of behavior, you see, you might not be able to really effectively measure them, or you might not feature them in your research if you're only using just one country in your study. All right, now impact on research studies continued in Western culture may not apply to non-Western cultures. I believe that is understood, right? So we can also have cross-cultural research. This is essential for creating universally vivid psychological theories. This is actually when you try to include multicultures in your study. All right. So the strength, it helps identify cultural bias in psychological research, encourages diversity and inclusivity in psychological studies, promotes cross-cultural understanding, improving real-world application. What about the weaknesses? Some behavior may be misinterpreted due to cultural differences. Okay. Researchers may impose their own cultural value when analyzing findings. That is subjectivity, right? the way they interpret it is actually based on their culture. Okay, it can be challenging to conduct research across multiple cultures due to language barrier. That's another issue with it. Okay, let's move on. Reductionism versus holism. Yeah, these are the this is one of the um, versuses, let me put it that way, that we have in the study. Reductionism. What does reductionism mean? It actually means reduced. Okay, there is a word reduced from it. Holism means a whole. Okay, like full, complete. Now, reductionism explains behavior by breaking it down into basic components, such as genetics, okay, neurotransmitters, or stimulus response association. Okay, now you want to explain the reason someone fought, and then you just said it's just because of one thing. Or let's say, for example, you want to explain the reason why people have mental disorder, talking about schizophrenia, for example, or let's say depression. And then the only thing you can think around is that, okay, yeah, because the person has low dopamine. So that's the reason he's suffering from depression. I mean, that is the explanation. Yeah, it's possible that the person might really have low dopamine. But what we're talking about is that the only cause of it? That is the question. Is that the only cause why the person is having depression? There could be other factors. There could be that people around him are showing hatred. Am I right? There could be a possibility around that. Maybe people around him or her are showing hatred towards him. Now, you're not focusing on that. You only pick just a single point, and then you explain a full behavior. Human behavior is very complex that sometimes when you ask someone, why did you do that? He might explain, or he might have a lot of reasons if he's able to analyze effectively. But then now, trying to bring it out to just one point, one component, that is what we call reductionism. Okay, now example, biological reductionism. Actually, the biological explanation, especially in the A level, the biological category are mostly, let me not say always, but let me just be safe to use the word mostly reductionist, because they focus on a single part, for example, genetics, all right, or look at dopamine or neurotransmitters, okay, or maybe the brain structure, and then they believe that is the cause of the behavior. They fail to look at what is the reality of the person, what is the person facing in the real world, what is the environment the person found himself, what is the culture where the person found himself. All right, so which will lead me to say that cognitive explanation are mostly holistic, or they support the holism explanation. Now, example, behavioral reduction, explaining behavior only in terms of learning and reinforcement. Okay, you just say that, okay, this person has learned this behavior and that is the reason he's behaving like this. Although this is kind of cognitive too, but if you're focusing on this alone, all right, then it can be reductionist. But if you're trying to say how the person learn, how the social factor interact with the person's cognition now, then you're talking in terms of holistic, by trying to interpret this environment the person find themselves, the person's thought process. You're including both environmental factor and cognition, then that is holistic. Now, what about holism? Considers behavior as a complex interaction of multiple factors, including biological, social, and cognitive. I mentioned biological in the reductionism earlier, right? Now, but if you're able to talk about how the gene interacts with the social environment, for example, there was a study on Shakhtar and Singer, okay, which explained the two-factor theory of emotion, and then explains the physiological factor, how our increased heartbeat, okay, and how our cognitive labeling, that is when we have increased heartbeat and then we are able to process a particular thought, okay, that this thing is fearful, then you feel emotion of fear. All right, so they explain that two factors. So it could be biological factor, maybe you have increased heartbeat and then you think in your mind. So the combination of biology and cognition now has brought it out of reductionism and made it holistic. All right, now what is the strength? Reductionism allow for scientific testing and precise research. That is the benefit of reductionism, okay, because complex things might be complex to measure. So if you're able to focus at just one thing, you'll be able to measure it effectively, okay, and you'll be able to give a precise explanation. Okay, holism also provides a more complete understanding of behavior by considering multiple influences. Okay, what about their weaknesses? Reductionism may oversimplify human behavior, ignoring important social and environmental factors. These are just examples. All right, holism can be difficult to test scientifically because it has multiple factors. Okay, making findings less reliable and less practical. All right, let's move on to the next part. Determinism versus free will. This is another aspect. Determinism, the belief that human behavior is predetermined. Okay, it's just like we are destined to be like this. All right, something has determined your behavior. Let's say, for example, if you have parents that are tall, then you are determined to be tall, something like that. All right, so the biological aspects kind of support the deterministic. Okay, if you're able to interact with your A-level studies, you'll be able to see a lot of things. For example, someone having this kind of gene. Okay, looking at twin studies, looking at the relationship between parents and children, and then we are studying their gene. So basically what we are trying to look at is what gene does the parent have. Okay, and then we can also find similar gene in the child, so which means the child is not going to behave the way he wants, but rather the gene will determine who he will be, what it will become, the kind of behavior is going to express. Okay, looking at parent that get angry easily, and then seeing a child also get angry easily, and trying to study genetic factor that could be responsible for the anger in such family. All right, so that is deterministic. Okay, in approach, the belief that human behavior is predetermined, okay, by internal or external forces. Okay, meaning individuals have no true choice. They don't choose what they want to become. Their behavior is already determined by some forces beyond their thought process. Okay, so biological are mostly deterministic. Okay, so for example, genes, you don't control them. You don't choose the gene you want to have. You don't choose the hormones you want to have. You don't choose your brain structure. They dictate their behavior. So this is the biological aspect. Now, what about the environmental aspect? Behavior is shaped by past experiences and surrounding. All right, this is also deterministic. If you believe that, okay, because you had this particular experience in the past, then you're always going to be like this, that is deterministic. It fails to consider that, okay, despite the fact that you had this in the past, you can decide to be someone different. So deterministic ignores that. Okay, so it's basically a predicted kind of behavior system. Okay, psychic determinism, unconscious drives, that is according to Freud, which influences our action. Okay, there are drives. Okay, looking at, for example, the Oedipus complex, that believes that, okay, male child um, will be attracted to the mother. Okay, and there is another one, I forgot the exact name. Okay, which explains that female child will be directly attracted to the father. Okay, so those are also deterministic. Okay, now free will, the belief that individual is active when it comes to choosing behavior, that individuals actively choose their behavior and personal responsibility. Okay, and personal responsibility play a key role in decision making. So people choose who they want to become, what they want to do. All right, that is free will approach. Okay, now let's take an example. Um, okay, majority of the biological explanation, just like I said earlier, they are mostly deterministic. Let's say, for example, the depression, when someone having low dopamine, then we can already predict that the person is going to have depression. That is deterministic. Okay, but and it fails to consider the fact that, okay, people can choose to, even if they have low dopamine, they can choose to live a happy life. They can choose to engage themselves in some activity that is going to boost their dopamine. All right, which might not make them to experience um, the depression. All right, sorry, I was losing my thoughts. Okay, I'm also trying to consider other explanation of depression. Okay, looking at the cognitive triad. Okay, cognitive triad, to some extent um, okay, we have cognitive triad and learned helplessness. So to some extent, that can also be deterministic because the person has a routinary way of thinking. Okay, however, it also focuses on the free will. The reason I'm talking about the free will is because the person has the choice to decide which behavior he wants to exhibit. But okay, they mostly only fail to effectively analyze the situation themselves. All right. So someone can decide to bring out positive thought around it, and then someone can decide to bring out negative thought. Okay, depending on the situation. So free will believes that people can choose which behavior they want to exhibit, but deterministic believes that okay, the people's behavioral pattern is already predetermined. Now, strength determinism allows for scientific study, making behavior more predictable and testable. Free will support the idea of personal responsibility, right? You're responsible for your behavior, your choice, your decision making, which is important in legal and moral context. All right. Weaknesses. Determinism undermines human autonomy, human dependence. Okay. Now, suggesting people lack control over their action. Okay. Free will is difficult to prove scientifically as it relies on subjective experience, rather than empirical data. So some psychologists argue that behavior is influenced by both determinism and free will, requiring a more balanced approach. All right, let me move to the last aspect, which is the idiographic versus nomothetic approach. So this was newly added into the syllabus. All right, now idiographic approach believes that individuals are unique, okay, focus on individuals and unique cases rather than forming general laws. Now, what this basically talks about is, let's take for example, the CBT kind of therapy. They are mostly idiographic in the sense that you speak with one person, you carry out a case study, you focus on the person. How do you treat an individual? You look at different method to actually treat that individual. So you are trying to tailor your approach to a single person, and in that way you are able to gather a lot of data, a lot of qualitative data, and you're able to pattern the approach to the person effectively. Nomothetic, on the other hand, just tries to get a general law, a general pattern that can be applied to everybody. Okay, so it kind of supports the quantitative approach. You just get data that can be used and applied to a vast number of people. Okay, compared to idiographic, which is more like a qualitative kind of data that you're getting around the participant. Okay, and then you are focusing more like a case study, one person idea of a particular person. So it treats people as unique cases. Let's look at the study of autism, the boy with button phobia. So what they carried out is idiographic. The way they treated the boy might not be effective for another person because they carried out the study around the boy alone. All right, you can check my video on that as well. All right, Savidra and Silverman, button phobia. All right, so the way they carried out that study, they tried to tailor all the approach, the technique, the treatment, their explanation, the causes of the boy's phobia just for the boy alone. So they treated the boy as a unique case. Okay, now example: case studies, qualitative research, and personal narratives. All right, now nomothetic approach on the other hand, okay, focuses on establishing general laws of behaviors based on large sample size. So they try to gather information from a large sample and then they establish a law that everybody is like this. Okay, now example: carrying out experiment, correlational study, and large scale surveys. All right, now idiographic approach provides in-depth insight into unique behavior. Nomothetic approach allows for scientific generalization, making psychology more applicable and predictive. Weakness: idiographic research may lack generalizability as findings are based on small sample size or individuals, just one person. Right? Nomothetic research may overlook individual differences, treating people as number rather than unique individual. Okay, so the best approach is to combine both. All right, so I think that is it. Yeah, thank you very much. I believe that this has been helpful in simplifying the AS issue, A level issue and debate. All right, you can check out for my other videos. All right, and then I want to urge you to subscribe to my channel, like my videos, share my videos, and comment on them. I wish you all the very best. Okay, goodbye.